A very good morning to everyone. Welcome to today's session on UTI in women. To speak on the topic, we would like to welcome Dr. Jyoti Bhaskar, in-house consultant, obstetrics, gynecology, infertility, and IVF. She has done her MBBS, MD, MRCOG, UK, FICOG, and PG in MILS. We welcome you, Doctor. You can now take over the session.
Thank you so much. So, good morning to everyone. Today, I'm going to be talking about a topic called the urinary tract infections, which is commonly known to each one as UTI. I'm sure each one of you would recall that particular incident when you may have suffered from UTI. The incidence among women is quite high. Every 1 in 2 women in their lifetime have at least one episode of urinary tract infections. And it has been seen that in girls less than 24 years of age, 1 in 3 girls, by the time they are 24 years, do suffer from one episode of urinary tract infections. Even recurrent, that is more than one episode, having more than 2 episodes of UTI in a year, is quite common. It occurs in about 20 to 30% of women. The question that comes to each one of our minds is why women suffer it so much as compared to men. And this is because of the way our anatomy or our development is. We have a very short urethra. Urethra is that part through which the urine actually flows out. As compared to men, which have it very long, women have it very small, maximum about 2 centimeters. Second reason for women having it much more than men is that the urethra, that's the opening of the bladder through which we urinate, is very close to our anus from where we defecate or where we pass a potty. The distance between the two is so small that if we do not take good care of our perineum, we do not clean ourselves very well after passing stools, we are likely to infect our urinary system with the bacteria which comes out from the potty. This makes women a little more prone to developing UTI. So now, let us understand what the symptoms of UTI are, so that each one of you know that when you have these symptoms, it is probably urinary tract infections, and you need to reach out to a gynecologist or to a physician. The most common symptom that women do face when they have this infection of the urinary bladder is that they need to go to the bathroom very frequently. They just go to the bathroom, empty themselves, they come back, and again, within the next 15 minutes, they have the sensation that I need to go and pass the urine again, something that we call as a frequency. When they do sit down to pass urine, there's an intense burning sensation as the urine tends to come out from the urethra. Many a times, women tend to feel a lot of pain even after having passed the urine. Some women do complain of pain in the lower tummy, that's just below the umbilicus, and this pain tends to intensify as they pass the urine. In much more severe infections, even the blood may be present in the urine. If this infection is not taken care of, it remains untreated, then this infection can spread from the urinary bladder up to the kidneys, which we refer to as pyloritis. This is much more severe form. And in here, you may have a pain at the upper part of your back. That's the kidney area. You tend to develop high-grade fever. You may have fever with a lot of shivering. This fever can also occur in urinary tract infections. And when you have these symptoms, you need to know that you need to go and contact your gynecologist or your physician because you may be suffering from urinary tract infections. Thus, to divide the urinary tract infections, simply, we can put it as 3 parts. One, which occurs to urethra, that's the passage from the bladder to outside. The second, which affects the bladder itself, called the cystitis, which is the most common form of infections and which can be easily treated. And the third is when it tends to move up to the ureter and the kidneys, which is referred to as pyloritis, in which you need admission, higher injectable antibiotics. The course is a little long and it takes a little time to be all right. Now, the second factor I would like to discuss that which are the women who are more likely to develop urinary tract infections, or what are the causes for having higher incidence of UTI. The commonest thing that I've heard, which I would say is a myth by all the girls who do have UTI, that madam, probably I used a public toilet. Probably the toilet I'm using is not clean, and that is why I have developed infection. This is a myth. The reason you're more prone to infection is when your intake of water is comparatively less. This occurs more in summer season because the lesser water you intake, lesser you go to pee, and the lesser amount of peeing that you're doing, more longer the organisms remain in the urinary bladder, exposing you or making you more susceptible to urinary tract infections. Chances of infection are higher after a sexual activity, and hence it is recommended that after a sexual activity, it's better to go and empty your bladder. Certain types of contraceptions also tend to make you more prone to urinary tract infections, especially if you're using spermicide jellies, you're using diaphragms, cervical cups. These particular ones tend to contain certain infections over a period of time and make you more prone to develop UTI. Another category of women which are more prone is the menopausal women, the women who tend to stop having periods. At that particular time, because of the lower levels of a hormone called estrogen, which is the female hormone, it tends to make all the lower parts of the private parts, the vagina, much more thin. It tends to decrease the strength of the mucosa all around the urethra and the vagina and makes the women much more prone to develop this infection. Apart from this, anyone who's got renal stones or bladder stones, some of the women who do have certain congenital malformations of the urinary bladder, or we would say of the ureters, are higher or more prone to develop urinary tract infections. So once, based on your symptoms, you feel or you know that you have developed urinary tract infections, what should you do? Fix up an appointment. Go and meet your gynecologist. She's going to just have a look at your tummy. Maybe there's a tenderness in the lower abdomen. She's going to ask you a history, whether you have any vaginal discharge, because sometimes the presence of vaginal discharge and local itching in the vulva area, you may tend to confuse it with urinary tract infection, because the last drops of urine which tends to fall on your private parts or vulva may cause intense irritation, and you may feel it is a part of urinary tract infection. So in the absence of any vaginal discharge or any local vaginal itching, if you do have symptoms of increased frequency, urgency, and pain during passing urine, you are likely to have a urinary tract infection. Your doctor will advise you to give a sample of urine for urine routine examination and culture. I would recommend each one of you that when you're giving a sample, please first clean yourself up with water. Discard the small bit of initial part of your urine and collect the middle part of the sample, which is called the midstream urine. This is very important because if we do not collect the sample properly, we may get reports which show contamination. You may not be suffering from infection, but still we may be able to grow the organism. The collection should always be done in a sterile container which is provided to you by the lab. Do not use any container from the house, collect the sample and take it to the lab. That will not work. We need a sterile container given to you by the lab to be collected and then handed it over to him as early as possible. Apart from this particular sample which has been given, The advice that you're likely to get is that, first of all, drink enough water. Approximately 2 to 2.5 liters of water is to be taken so as to be able to flush off all the organisms that may be present in your bladder. Intake of cranberry juice is also considered to be quite effective, though we do not have enough evidence to say, yes, this is substantially a treatment method. But yes, taking certain amount of cranberry juice tends to dislodge the bacteria that are present in your bladder. Other medications that may help you is by taking any alkalizer, which can make your urine a little alkaline and hence decrease the burning that may take place. We have certain other medications which tend to reduce the pain when you pass the urine as well as a burning sensation. One of these can also tend to make your urine a little orange, but you do not need to worry about that. After you have given off your sample, immediately after giving the sample, the doctor will advise you to take antibiotics. We do not need to wait for the report of the urine to start the antibiotic. This I'm specifying because I've seen several women. They come back to me after 3 to 4 days with the report of the culture, but they've not started the antibiotics, thinking that it will only be started after the culture report. We recommend that you give the sample and start the antibiotics. Another thing I would like to tell each one of you, do not start the antibiotic on your own. Just starting the antibiotic, taking a course only for a day or two, since you start feeling better after that, tends to increase the resistance of your organism to the antibiotic. By what I mean, the antibiotic which may have worked on you before may not continue to be working for you later on. These organisms that are there in your bladder no longer are suppressed or susceptible to these antibiotics. So only take the antibiotics which are prescribed by your doctor for a duration that they have asked you to take it. Normally, if this particular antibiotic is effective, you will tend to respond to the treatment within 24 hours and you start feeling much better. But in case in 48 hours, there's not much of an improvement in your symptoms, please back to your doctor. Collect your culture report and come back and show to your doctor you may need a change in your antibiotic. After the course of antibiotics, a week later, we recommend you again to get our culture done. If the previous culture had shown an infection, to be able to confirm that you have been adequately treated. These particular steps have to be taken, and you have to take it as per the advice of your doctor if you wish to prevent this infection occurring again and again. If after 2 weeks of your antibiotic, you tend to redevelop the urinary tract infection, again you may need to get a culture done, see if it's the same organism or it is another organism that has caused the infection and you may require a treatment again. Some women tend to have more than 3 episodes of urinary tract infections in a year, or more than 2 within 6 months. These women are said to have recurrent UTI. If one is having recurrent UTI, after the initial course of treatment, we may advise you to take small dose of antibiotic daily for a period of 3 to 6 months to be able to completely cure your bladder of this particular organism. I would now also like to tell you that what steps can you take to prevent this infection from taking place and to occur again and again. As I already said, it's very important to drink enough water. Keep 2 bottles full of 1 liter each and ensure that you have at least 2 liters of water daily. After each sexual activity, it's better to go and empty your bladder. Thirdly, when you clean yourself up after passing stools, ensure that you use the method from front to the back. By front to the back, I mean to say that if you're using any jets for water, it should be starting from the front. In case from the jets which are placed at the back, our movement of the hand is always from the anus to the front. By doing such a thing, we tend to transport the organisms present in the anus near your urethra and you expose yourself to higher infections. So please use and try and adopt the technique of cleaning yourself from the front to the back. It's important to keep changing your panties in case you do have any vaginal discharge. If you're using any contraceptions like condoms or like cervical caps or diaphragms, and you have recurrent UTI, please change it over to either birth control pills or copper T, depending on whatever your doctor tends to suggest to you. Using these particular methods can help decrease the incidence of urinary tract infections. A little word about urinary tract infections during pregnancy. Pregnant women, unfortunately, are more prone to develop UTIs. And they also sometimes may not at all be symptomatic. Yet, when doing the urine examination, we find that they have bacteria. And when we do a culture, it shows that they have a growth of organism at a rate of, I would say, at a count of greater than 10 raised to the power of 5. This presence of asymptomatic bacteria, as we call it, in pregnancy needs to be treated. For it tends to lead to higher rate of preterm deliveries. It tends to lead to having babies which are smaller in weight. Hence, to prevent these problems in pregnancy, every obstetrician asks her pregnant woman to get a urine routine and a urine culture done at the first antenatal visit. In case we do find that there's infection in the culture, even if the girl is asymptomatic, has no symptoms, we treat it. And then we repeat it in every semester. A pregnancy has got 3 trimesters. So we tend to repeat this culture in every trimester. Treatment of this asymptomatic bacteria is only recommended for pregnant women. Any other woman, males, who are low risk and who on any routine examination tend to have this particular culture which is positive but are totally asymptomatic, we do not need to treat them because these organisms are sometimes helpful to the person in preventing further infections. And hence, the women who are hearing me here, I would like to tell you that do not sit at home if you have these symptoms. Recognize them. Reach out to your doctor. Take a treatment as prescribed by them. Do not do empirical home therapies. For we need to treat the first episode well so that you do not develop into recurrent urinary tract infections. Once the treatment is complete, we would recommend you to get a culture again to ensure that it is treated. Take the steps as I have said to prevent further infections to take place. Urinary tract infections, though it seems nothing very big, for it can be easily treated. But if left untreated, if it tends to become severe, can lead to infection of your kidneys, can lead to high-grade fever, can lead to infection which is called as a sepsis of all your body. So be careful, be vigilant, and be proactive. Thank you very much.
Hi, Doctor. Thank you. We have a few questions, Doctor, from the audiences. Yeah. So the first question is, um, can can taking baths make the UTI worse? Does baths or shower make UTI much worse?
No, I would not say that taking baths make by showers, you would say, would make the UTI worse. What is more important is that when you are taking bath, try and use your hand clean from the front to the back in your private areas. Do not use any deodorants, any soaps, any special, maybe any other thing apart from fresh water to clean your private parts. Using all these deodorants, soaps, lubricants tend to increase your chance of having urinary tract infections. Yes, going to swimming pools can increase urinary tract infections, especially if the water is not well circulated in the swimming pool, and especially if the swimming pool care has not been taken. So, when you do go to swimming pools, ensure that they clean up the pools daily. The water is continuously circulated because that can sometimes become a source of infections. Yes, Jyoti.
Right. The next question is, Doctor, what can I do about my discomfort before I am treated if it hurts when I pee?
Okay. So first of all, when you start recognizing that when you're peeing and it's going to be painful, you're having a lot of burning, increase the water intake. Just start taking more water, about 2 to 3 liters of water. Then, as I was talking about the alkalizers, there are certain alkalizers available in the market. You can take those because they tend to make your urine more alkaline, and thus the burning sensation that is going to take place is going to be much less. Even if you, before you reach your doctor, if you're getting delayed, at least contact a lab and give your urine routine and culture. And then, so that at least you save the particular time until you reach the doctor. You can also take certain painkillers which are there, especially Drotin or Urospas, if you are not able to reach out to your doctor before you take that, because that can help decrease the pain that happens when you tend to pass your urine. But ultimately, you need to work fast, get an appointment, and reach out to your doctor so that the antibiotics can be started in time. Yes.
So the next question is, Doctor, how long can you have a UTI before it spreads?
Before it is detected.
Yeah, before it spreads. Sorry, how long can you have a UTI before it spreads? Yeah.
It's not a question of spreading. What I mean to say is the spreading means to the ureter and the kidneys we are talking of. So it also depends not only on the duration, but the severity of infection that you've been having. So if you've been having a urinary tract infection, you're having the symptoms for last 5, 6 days, and you're doing nothing about it, and your symptoms are continuously increasing, then it can move up into your ureters and it can move on to the kidney, especially when you start having fever with chills and rigors. So, to be able to define a time that it's 3 days, 4 days, 6 days, or a week, it's going to be extremely difficult. But yes, if we do nothing for the next 5 days and your symptoms are increasing and you're developing fever with chills and rigors, this could signal that it is spreading up and it's involving your ureters as well as your kidneys. If another sign is that when you start having a pain in your back, that's the upper back, when you start having a lot of tenderness and pain there, that means your kidneys are getting affected and you need to reach out urgently at that moment. Yes.
Um, the next question that we've got is, Doctor, um, are abnormal white discharges a sign of UTI?
Yeah. So this, I think I need to elaborate on this a little. Abnormal white discharge is not a sign of UTI. When we describe a UTI, we say that presence of frequency, urgency, and dysuria in the absence of vaginal discharge. The white discharge comes from your vagina. This white discharge, if it has got no itching, if it does not have any foul smell, is physiological and it is normal and it is not a sign of urinary tract infections. Many girls are unable to differentiate between the two of them. So when I ask them only one question, that while passing your urine, do you have pain? Do you have burning? Or do you have burning when the drops of your urine fall on your private parts? If the burning is when the drops of the urine are falling on your private parts and that particular part is painful, it means you have basically a vaginal discharge and infection. But when you have pain while passing urine, when it tends to come out of your urethra, that is a urinary tract infections. So presence of vaginal discharge is not UTI. It is vaginal discharge which needs to be taken care of separately. Yes.
Another question that's here is, Doctor, does drinking cranberry juice stop a UTI?
It would, what we would say that yes, it tends to prevent development of UTI. But again, I would like to say with caution, we do not have enough evidence, enough studies to show that it is a very good treatment or prevention modality. But there are certain studies which have shown that cranberry juice tends to reduce your chance of developing infection. So please, it is with a word of caution. But there are certain tablets of cranberry juice also available. There are certain juices available, but don't overdose on them just thinking that you can prevent it. It is one of the adjuvants. It is not the mainstay of prevention.
Right. Thank you, Doctor. The one last question before we conclude today's session is, Doctor, can a UTI cause bladder cancer?
UTI per se cannot cause a bladder cancer, but if the UTI is associated with other things like a persistent stone in your bladder, if it is associated with certain anomalous conditions within your bladder, they may cause UTI, but UTI by itself does not lead to a bladder cancer. So I do have a question on a private chat, so probably I'll reply to that person about here. The question that maybe it may help out a lot of other people also. So a girl has asked that I'm pregnant and I have UTI. Should I be worried? Yes, you need to be worried. As I did say, that any infection of the urinary tract infection during the pregnancy needs to be treated. If it is adequately treated, it will not cause a problem to you. But you need to be vigilant. Keep getting your urine culture done in every trimester of your pregnancy. If it remains untreated, then it can cause your baby to be born much earlier than term pregnancy, which we refer to as a preterm pregnancy, or the baby sometimes is a little smaller weight as compared to the normal weight. So a UTI in pregnancy has to be treated and treated completely under the supervision of your obstetrician. Right,
That was the last question, Doctor. Thanks a lot for your time. We loved having you here on today's topic. We look forward to having more such topics with you, Doctor. Thanks a lot. Thank you, Doctor.
Thank you so much. Okay.